Pfizer has officially asked Health Canada to approve its COVID-19 vaccine for kids aged 5 to 11. This is the first vaccine submission Canada has received for this age group, and Michael Serapio, this is going to be, for many parents, a big relief, a big reassurance. What is the timeline?
Well, as you know, Heather, we've been speaking to doctors these many months, and they have been speculating that a vaccine for children under the age of 12 would be available by the end of this year or the beginning of next. And with this development, we really are one step closer to seeing that to fruition. As you say, Pfizer, now the first drug maker to ask Health Canada to approve their vaccine community for children between the ages of 5 and 11. Now, this does follow a trajectory whereby vaccines have been approved little by little for younger cohorts. Last December, it was vaccines approved for people as young as 16. This past May, it was for kids between the ages of 12. And now this asks for children as young as the age of 5. Now, as we understand it, the dosing for children in this cohort would be about 1/3 the size currently given to adults. Now, apparently Canada does have enough of a vaccine stockpile to get those doses out and inoculate every kid between the ages 5 to 11. But it may not be as simple as taking one adult vial, dividing that by 3, and then distributing it to 3 kids. Take a listen to what we heard from Dr. Teresa Tam in her latest update.
Drawing up pediatric doses from the existing vials is not something that is recommended at this point for a number of reasons. We also understand from Pfizer that there's the formulation has shifted. So this is their sort of next generation formulation. And so that is something that needs to be examined by the regulator.
So a delivery of doses would be something that would affect the timeline here, Heather. Important to note that Canada already does have a contract with Pfizer for these pediatric doses. But Health Canada, well, they still have to review the vaccine safety. The agency saying that it will only authorize the use of community if the review shows that the benefits outweigh potential risks for the age group. And once Health Canada is done, it will then go on to the National Advisory Committee on Immunization, or NACI, for their review. And of course, we know there is some risk with mRNA vaccines writ large. The Public Health Agency of Canada citing rare incidences of myocarditis, or inflammation of the heart muscle. But of the more than 57 million doses administered in this country, Health Canada has only noted less than 900 cases with the vaccine. And for those who are looking at the positive, well, they say the vaccine will protect kids from the more serious effects of COVID-19 and reduce the risk of passing on the virus and disease to more vulnerable family members. But of course, Heather, this is what Health Canada and NACI will be looking at very closely in the weeks to come.
And those kinds of questions for parents, those are questions we're going to discuss with Dr. Bogosh, too, later this morning, Michael, in the 8 o'clock hour. So this is for kids 5 to 11. What about children under the age of 5, Michael?
Well, it may be interesting for people to hear that Pfizer has been testing their vaccine on children as young as 6 months, Heather. And the initial data for their trials for, again, children under the age of 5, well, that's expected as soon as the end of this year, with Health Canada also saying they expect to receive the data for review for younger age groups coming in the next few months from Pfizer, not to mention data from other manufacturers as well. So while we don't really have a date on vaccines for children under the age of 5 quite yet, it is being worked on. And of course, it's something that we're tracking very closely as well.